From WNYT Albany, News Channel 13 live at noon begins right now.
Welcome back. An estimated 21 million Americans now have diabetes, and that number is expected to grow. One serious consequence of the disease can be vision loss or blindness. November has been declared Diabetic Eye Disease Awareness Month. Dr. Ramsey Elhosn from St. Mary's Hospital joins us now. Thank you very much for being here with us.
Thank you for having me, Sabrina.
So I think in general, the average person associates diabetes with blood sugar, with watching what you have to eat. How can it affect your vision?
Well, diabetes is a very serious problem in the United States and abroad. Diabetes, what happens is the blood sugars become elevated, and they can damage the small blood vessels in the eye, specifically in the retina, which is the nerve layer of the eye, and they can become damaged. They can leak fluid, they can bleed, and if that fluid leakage is close to the center of your vision, then the symptom would be blurry vision.
And eventually progressing to...
Eventually progress into blindness if untreated.
Only 38% of adults who don't need to wear glasses go for checkups every 2 years, an eye exam every 2 years. What are the dangers of people not going, and is this included in a regular eye exam? Well,
the dangers of not going, especially for diabetics who have no symptoms, is not detecting the disease early enough. And initiating treatment that could save their vision in the long term. These people, the patients who don't come in can risk loss of vision within 3 to 4 years of having bleeding or leakage within the back of the eye.
Wow.
And that can be changed around if they came in soon enough and had us take a look at their eyes to detect it. And it is included in the normal routine eye exam. Every eye exam should include a dilated exam. That's where you put the drops in the eye. The pupil becomes very big, and we can look inside the eye, and we can look at the retina, at the blood vessels. We can look at the macula, which is the center of your vision, and we can assess whether there is any diabetic retinopathy or not.
You mentioned some people who don't have the symptoms of diabetes but still have the disease. So what are the symptoms to look for? How quickly can this progress?
The symptoms can progress fairly quickly, usually in the later stages of diabetic retinopathy. Probably one of the quickest progressions is when somebody bleeds inside of their eye because of the fragile, weak blood vessels that leak blood and fluid. And that can present very quickly with complete loss of vision. It can start out first with floaters or red black spots floating around in your vision to complete loss of vision. And that's usually when people come into my office.
When they're at that stage.
When they're at that stage. It would be much better as far as treatment and outcome if they came in sooner before these symptoms happened.
Preventive care, exactly. All right. Dr. Elhosn, thank you so much for being here with us.
Thank you very much for having me.
We want to hear from you. If you have a question on any of our segments, send us an email to live@noon@wnyt.com. You can also find us on Facebook and on Twitter.